good friend, Democratic strategist and co-host of Left Jab on Sirius XM. And in the red corner, Republican strategist Matt Mackowiak. And David, good friend, what is going on the Democratic side?
Well, it's called legislating. It's messy, it's not pretty, it requires a lot of work, it requires spending political capital on the part of the president, and he's prepared to do that. And I think we should all take a deep breath and realize that we still are only a half a year or so into the Obama administration and the new 111th Congress. And for the first time, members are being asked to cast their vote in a markup, that's in a committee, to actually craft this legislation. The president still has the wind at his back in the sense that the American people do believe the healthcare system is broken. They do trust Democrats and the president in particular more than they trust Republicans. This is how the work gets done, issue by issue, vote by vote. As I said, it's not pretty, but the president is putting his effort and his political capital into it, and I think he's going to get his goals achieved.
Matt, is the Republican effort about stopping health care reform, or is it about somehow ruining President Obama politically?
No, it's about stopping a bad idea that's going to be bad for the country. I think the big problem...
Well, just so we're clear, you and Senator Jim DeMint have a different idea, but go ahead, go ahead.
Well, look, I think stopping a bad policy is also good politically, so I think there's a joint benefit there. But I think very clearly the people that are blocking this most effectively right now are moderate Democrats in the House. Remember that there are 3 committees in the House that have jurisdiction. 2 of them have reported the bill out, 1 has not, the Energy and Commerce Committee. They were supposed to mark up the bill, to take up the bill today, and they postponed it because President Obama wanted to bring them to the White House to try to negotiate with them and earn their support. It's unclear whether he has that. In the Senate, the bill is out of one committee, but they haven't marked it up in the Senate Finance Committee. What President Obama and the White House knows is the longer the health care bill is out there, being judged, with questions being asked, with the American public learning more about it, there are more questions raised and there is deeper concern, and that's part of the reason now that you saw, as you stated, only 49% approve of Obama's handling of health care, and I think that they are very worried about the political prospects for the bill right now.
And David, obviously, sitting here all day long, we hear a lot of messages coming from people, and what Matt just said is very similar to what Congressman Cantor also said, making this a Democrat versus Democrat issue. With that said, you know, Secretary Sebelius was asked on Meet the Press, where does the president stand? Is it time for President Obama to look into that camera, maybe at this press conference on Wednesday or sometime soon, and tell the people who want change in health care what exactly he supports?
There's no doubt that the president's comments are becoming more and more specific. But remember, he made a very conscious decision at the beginning of this process to defer to Congress in ironing out the details as best they could before he offered.
Yeah, but David, the trust that remains, when you look at these polls, the trust that remains is the trust that the people have with the president. Now, the Republicans obviously doing very poorly. Their numbers, they're not even gaining in polls where the president is dropping. And, you know, Speaker Pelosi still not popular in these polls. The popularity is with that man we just saw in the video.
Well, I agree, Tamron, and my only point is he's made a conscious strategic decision to defer to Congress at the outset, and now if you listen carefully to his comments, they're getting more and more specific, and you're going to see this trend continue. As the issues are teed up and there are votes being taken and we need to have a majority call in, my Republican colleague is absolutely right. The president is bringing members of Congress into the White House and saying, all right, now I need you on this particular vote, on this particular issue, you're with me, and he's getting those votes. That's what presidents do. Look, every president, and George W. Bush was no different. You see him on the phone or in person talking to members of Congress. The Constitution set this up. It's Congress that legislates, and he's got to call on them.
Matt, are the Republicans bringing up this Democrat versus Democrat so that the Republicans are not to blame if this does not happen, if health care reform does not happen? Are the Republicans trying to save their skin?
You're asking who would be to blame if it doesn't go through?
No, I'm saying that today we've heard a lot of Republican strategists and lawmakers say that this is really about the Democrats versus the Democrats. Is this a way to try to pull yourself out of the conversation so that if it fails, that the Republicans don't take the blame for standing in the way?
And I'll add a secondary one. Doesn't it also allow Republicans gives them breathing room so they don't have to introduce their own plan?
Well, look, David, Republicans have ideas on health care. You know, you played up yesterday an interview where you said that crickets were sounding because one Republican on television didn't have specific ideas. Republicans have put specific ideas out there. Wellness prevention, equity with regard to tax treatment.
How are they going to pay for it?
How are they going to pay for it?
How are they going to pay for any one of those ideas?
Well, for one thing, the Republican plan will not be anywhere near as expensive as the Democratic plan.
But again, Matt, you just said that they have a plan. They do have a plan, but they don't have a plan to pay for it.
Well, it hasn't. Look, David, it hasn't been scored, but the ideas Republicans have are bipartisan ideas. Like I said, wellness prevention, equitable tax treatment, small business health plans similar to a co-op provision, tort reform, medical malpractice reform. But look, the bottom line here is: are the moderate Democrats going to vote for this, and are they going to allow this to pass? Democrats do not need to incorporate Republican ideas. They have 60 votes in the Senate, and they have a majority in the House.
And nor do we don't want Republican ideas, because listen, if I were bleeding and taken to the Republican emergency room, they'd say, here's a Band-Aid, now go home. That is not enough. What you just talked about is no recipe for helping our broken, ineffective healthcare system. Every American has a story. I have a story. Members of my family have stories.
But David, there's two.
You can't get treatment. It's broken. It has to get fixed. We have the answers. They've got nothing but no.
There's two important questions here, though. One is the bill going to be deficit neutral? President Obama has said it has to be. The CBO, a nonpartisan organization, said it would add $239 billion to the deficit over 10 years. The second point is regarding the Lewin Group did a study that said most Americans, almost 50%, will not be able to keep the private plan, which Obama has promised. 88 million people who have private insurance would have to go on the public option. That breaks the promise that President Obama made during the campaign, and since those are two enormous questions facing the health care bill.
All right, may I take those 2 points?
Real quick, please.
Number one, budget neutrality achieved. You guys are the ones complaining about having to pay for it. Guess what? Nothing in life is free. We need it. We got to pay for it. The plan calls for it. Number two, the study you cite is questionable. CBO and the Health and Human Services Department and Congress have all pointed out the option, the public option, is just that. It's an option. I can choose to take it or not. Nothing stands in the way of you and your doctor. Nothing stands in the way of your plan. It's an option.
Have it. You answered both questions, David and Matt. It's obvious that those crickets hit a nerve with you Republicans, so we will hold back on playing crickets when you don't answer the question.
At least for Matt. Matt knows a little bit more and is offering a little bit more than some of his Republican colleagues.
But the crickets hit a nerve, Matt. We will hold back.